Health, where we explore the latest in health across the country. I'm Erica Cardenas. As we enter the hot summer months and begin heading outdoors, we wanted to share sun safety tips to keep you healthy. But before we get started, let's take a look at what's coming up on the show. How one nonprofit is giving the gift of hearing and treating those suffering from neuropathy. Plus, we head to Mexico to visit a recovery center helping those with addiction. All that and more in this episode of Your Health. Skin cancer is the most common cancer here in the U.S., but with more awareness, we can keep everyone safe. Spending time outside is great during the summer, but it's important to protect yourself from the sun. Most skin cancers are caused by too much exposure to ultraviolet light that comes from the sun. The good news is it's one of the most preventable types of cancers, according to Dr. Ariana Rodriguez.
The reason for that is that there are several risk factors for skin cancer that are environmental or lifestyle risk factors, meaning that they're modifiable and avoidable. They're things that we can do to reduce our risk of developing skin cancer. One big one is decreasing our amount of UV radiation by just decreasing our sun exposure, reducing inflammation in the body by increasing our intake of antioxidants and antioxidant-rich foods. Smoking cessation is also a really good way of reducing inflammation in the body. Avoiding indoor tanning and indoor tanning beds. All of these things are ways that we can reduce our risk of developing skin cancer, which is why it really can be a preventable form of cancer.
In addition to adjusting your lifestyle factors, it's important to avoid the sun and seek shade when possible. If you must be in the sun, wear long sleeves, pants, and a hat to protect you from the damaging rays. But staying in shade isn't always possible, so Dr. Rodriguez says she can't emphasize the importance of sunscreen enough.
We know that it can reduce the development of actinic keratoses, which are kind of known as these precancerous lesions, and it can also reduce the prevalence of skin cancers, such as squamous cell carcinomas and melanoma, which is kind of the more severe, scarier form of skin cancer. When you're choosing the type of sunscreen that you want to use, you want to look for something that is broad spectrum, meaning that it gives you UVA and UVB radiation protection. Usually the types of sunscreens that you're looking for are going to contain zinc oxide and titanium dioxide. These are inorganic blocks that are going to provide you protection from the sun. You also want to look for sunscreen that is water resistant. If you're going to be swimming in the ocean or swimming in the pool, looking for sunscreen that is at least SPF 30 all the way up to SPF 50 is going to be your best bet with the type of sunscreen that you're looking for.
And how you apply your sunscreen is critical. Use your sunscreen 15 minutes before you hit the beach or pool. You want to use at least 1 to 2 ounces of sunscreen, which is about a shot glass full. Be sure to coat your skin evenly and make sure to rub it on the tops of your feet and ears. And if you have a large part in your hair, be sure to work some in there as well. You'll need to reapply your sunscreen every 2 hours and after swimming. And don't forget to do your own skin check to look for unusual or changing moles on your skin. And a yearly visit to your dermatologist will ensure you're not missing anything suspicious and potentially life-threatening. You can have your fun in the sun this summer as long as you're careful and protect your skin. The gift of hearing is priceless, and one nonprofit is providing that gift for many in the community.
Grace Hearing Center is our nonprofit. We've been around since 2016, and we are able to provide services to the underinsured and underserved in Tucson, Arizona. We have identified 20 people with hearing loss who are not able to afford hearing aids, and so we're able to fit them. We have Oticon has donated the hearing aids. Many businesses in Tucson have donated their time, treasure, and talent, and we're going to be able to fit all 20 of them today, and they'll have the gift of hearing.
So, well, you were in the right place. So, Rudy, we have custom ear molds for you and hearing aid action.
Oh, I'm like a little kid.
Yay!
I want to try.
If you have diabetes, then you're twice as likely to have a progressive hearing loss. And so that's what started Grace Hearing partnership with El Rio, is that we started to test hearing next to the diabetes clinic. But it can be because we're living longer. It can be because there's genetic reasons. Noise exposure is huge. So we just want to get everybody at least a baseline. Maybe they have good hearing, but then we can compare it to what their hearing is down the road if needed.
You know, it just makes a whole lot of difference. My quality of life is going to be better. I'll be able to communicate and really listen to what they're telling me, like my husband, my kids, my friends, and even for my entertainment.
This is my son.
Ay, qué lindo.
And he wears hearing aids too.
Oh, those are cool.
I know.
Oh, yeah.
He has had hearing aids his whole life, and it has helped him his whole life. So we always like to come do this work.
I think it's important because I'm helping my own community, hearing impaired community, and I'm giving people hearing aids that need them. And since I'm a part of that community, it really does make me happy because I actually really do love giving back to people. And seeing people finally be able to hear really makes my day.
We've had people who have been able to get a job, who went from being on the couch to getting a job to getting married, and now he's a father. So we've been able to see everything. We've had kids who now school is so much easier, grandparents who can hear their kids again, and grandkids. It's been pretty phenomenal. We can't wait to see the hearing smiles. If you want to be a patient of ours or know somebody who needs our services, or if you just want to give your time, treasure, and talent, please go to our website.
Sun safety isn't just about your skin. Heat illness occurs during the summer months when the temperatures rise. Try to shift your outdoor activities to the cooler times of the day. Take breaks when you're hot and stay hydrated with plenty of water. But before you reach for that H2O, let's see what's coming up on the show. We head to Mexico to see how they're supporting those with addiction and how you can treat the pain of neuropathy. To Mexico to see how Baja Rehab is using a comprehensive program that uses holistic treatment for those suffering from addiction.
Baja Rehab is a high-end drug and alcohol treatment center in Puerto Nuevo, Mexico. We specialize in drug addiction and dual diagnosis. We're full medical detox, and we're a 60-day inpatient program. We really focus solely on drug addiction and alcoholism, and we understand there's complications with that. There can be, if somebody's using methamphetamine for a long time, they could appear to be schizophrenic, but what we found is if you take away the meth, we get them sober, we get them reassessed by a psychologist and a psychiatrist, maybe get them on a stable set of medication, that all the other outside issues, the schizophrenia goes away, and then we're just dealing with the substance abuse issue.
What got me here was, just hurting my family for years and years of dabbling around with, drugs and smoking weed through high school, stuff like that. Then started dabbling with like coke, a little after high school, like parties or whatever. And then lately I just got addicted to opiate pills. Pain pills, and became physically dependent on it, just sick. I just keep taking steps backwards, and hurting my family, and it's time to just fully put in the work to get clean.
Baja Rehab is $5,000 a month, and our program is 2 months. And that includes full medical detox. The difference between Baja Rehab and rehab in the United States is that here in Mexico, the family member can have direct conservatorship over their loved one's care, which means that the family member, basically the addicted person, cannot check out until their family and our treatment team says so.
For anyone struggling that has gone through things, I have put my family through so much. And I've kept a great job for so long, I just can't get away from the devil, which is these drugs. And I'm done disappointing my family. I'm done hurting my business. And I have strong faith that this is the place that's gonna make me forever, take me away from that lifestyle forever, you know?
I would say in everyone's heart, they want to be sober, they want to function normally, they want to have this connection with society and the people, and it's taken from them. It's taken from them through addiction, and they need somebody to step in and help them. And that's what we provide.
It's estimated that 20 million Americans suffer from neuropathy, and the doctors at True Health can help your symptoms with their innovative treatments.
So neuropathy is actually more common than we think, and it is nerve damage. So there is over 100 reasons to why neuropathy happens. There is diabetic neuropathy, there is chemical and medication-induced neuropathy. There is also idiopathic, which means we don't know why it happens. But regardless of the reason, we need to know why it's happening and how to treat it. Over time, as these nerves are damaged, they cause patients symptoms like tingling, burning, cramping. Patients are not able to sleep. So with time, this can take a big toll on patients' quality of life. It's very important to treat neuropathy without medication because the medications are simply designed to mask the problems. So as we continue to mask these symptoms, they're just going to get worse. And a lot of these medications, they actually numb your brain, which means they numb the pain. They don't do anything about the root cause of the problem. Our most successful patients are ones that are highly motivated. They don't want the pill for an ill formula. We are the type of clinic that will work with people who are highly motivated to get better. In doing so, using these FDA-approved, groundbreaking treatment modalities, we're able to remarkably see patients do better. Our patients actually do really, really well, where we're able to see these symptoms go away because your body can heal. Your body can heal and wants to heal without medication.
Once the regimen was established, I felt comfortable with it, and I have shown nothing but marked improvement. When I first came in, it looked like this. Now that I'm completing my treatment, this is what I look like. Prior, I was experiencing neuropathy and cramps during the night. I couldn't sleep all night. Presently, I can sleep the whole night. I'm walking without a cane, and my quality of life has vastly improved.
So when our patients come in for nerve damage screening, we do a touch-based exam because these patients have been poked and pried so many times, so this is completely pain-free. This is one of our very severe cases, and you can see that because of the many areas that they have complete black. Black is total loss of function. You can see that just few short treatments later, they went from this to this, and this is how we know that they are actually progressing and then they're improving and their symptoms are going away. At True Health, we pride ourselves in treating all patients like family. So we bend over backwards for our patients. When they come in here for treatments, they want to be here, they love coming here. We have a location here in Chandler, Arizona. We're also located in Scottsdale. And we are ready for you to come in, again, for that free exam and consultations where we can go over your symptoms, see if you make a good candidate for the treatments that we have. We are ready for you. Let's get your quality of life back. You have nothing to lose but your neuropathy.
Another sun safety tip, stay out of the sun between the hours of 10 a.m. and 4 p.m. as it's the most hazardous time in the U.S. for UV exposure. Stick around, here's what's coming up on the show. We visit Avenir Senior Living to see all they have to offer their residents and wound care treatment that's helping patients get their lives back.
Watch Creative Living only on YourView. Check your local listings for air times.
Suffering from a wound that won't heal can impact your health, but the team of doctors at the Wound Treatment Center at Opelousas General have innovative treatments for your recovery.
The Wound Treatment Center at Opelousas General Health System has been here for 30 years. We have one of the greatest teams with a tremendous amount of experience. We're available 24/7, and we treat both inpatients and outpatients for a variety of wound complications. Wound care benefits patients by bringing together a multidisciplinary team targeted specifically to help get their wounds to respond to therapy and ultimately heal and restore them back to their pre-wound function. The most common types of wounds that we see in the Wound Treatment Center are related to diabetic complications such as diabetic foot ulcers and bone infections in diabetics, as well as people with venous disease where they have venous leg ulcers as a result of untreated venous hypertension. Another common group of patients that we see are patients who suffer traumatic injuries that are complicated by infection, as well as patients who have surgical complications with the resulting wound as a result of either an infection or some other failure of the surgical procedure. Currently, there are 14 approved indications for hyperbaric therapy. When the patients are referred to us for possible hyperbaric therapy, we review their records, talk to them, examine them, talk to their physicians, and then pre-certify them for treatment to make sure that it's a covered indication. The most common indications for hyperbaric therapy that we see here in our center are soft tissue infections, usually with what's commonly referred to as flesh-eating bacteria, as well as acute arterial insufficiency, where the patient acutely loses blood flow mostly to their extremities, or have complications following some sort of endovascular reconstruction. Surgical complications, of course, compromised flaps. Patients have a procedure, a flap is used to close the wound and it starts to fail for various reasons, as well as traumatic injuries that require additional oxygenation to help with healing. Another group of patients that we see here more commonly are patients with these chronic bone infections that don't respond to conventional therapy, as well as people that suffer complications from radiation, including radiation cystitis, where they're having blood in their urine, radiation proctitis, where they're having blood in their stool as a result of the radiation, and then most commonly patients who undergo radiation therapy for breast cancer, where they subsequently develop what's called radiation mastitis. So all of these diagnoses have been shown to improve with hyperbaric therapy.
Don't go anywhere, we have more Your Health coming up. Senior living and individualized care all in one place.
From fitness to medical technology, explore how people are leading healthier lives on Your Health. Join Erica Cardenas as she introduces you to health experts, examines popular fitness trends, and explores new treatments for common conditions. Discover how the choices we make in our daily lives directly affect our well-being. Plus, learn simple tips for leading a healthier life. Watch Your Health Sunday, Monday, Thursday, and Saturday only on YourView, or stream it online at yourview.com.
Place for our loved one to live as they age can be difficult, but at Avenir Senior Living, they're setting the bar when it comes to individualized care.
The origins of Avenir Senior Living really start from a family-based business. The company was founded by David and Violet Craik, And they started this company through their own personal experience. They had a loved one that was in a senior living community that they were not super satisfied with, and decided, because of their background in construction and design, that they felt that they could create a retirement community, a memory care community that was really deserving for their loved one. So what makes Avenir Senior Living very different from all the other companies in the senior living industry is we are a smaller boutique style company. Being a boutique style community or a boutique style management company allows us to really work closely with not only our management team and staff, but also our families and our resident families as well. Our resident really is our customer, but our customers really start with our family connections. So we work closely with our families to help support them with resources and education, because a lot of our families are coming into this situation without a very good knowledge of dementia. So we utilize our expertise and our contacts and resources in the healthcare industry to help these families navigate this journey. Some of our programs that make us very different from our other competitors is our cognitive lifestyle program. This is a program that's unique to Avenir Senior Living. And what it is that we assess our residents and we align them with other residents in our communities through their cognitive levels. So in our communities, we have an early cognition community neighborhood, an intermediate and advanced neighborhood. And what this does, this allows us to have our residents living with peers who have the same abilities and likes, and this allows us to then set up successful days through activities and socialization, which really helps to enhance their enjoyment of their day. A typical resident day here really will start with a nutritious meal. So our chefs are all our employees who work with registered dietitians to make sure that our meals and our menus offer a wide variety of nutritional options. We can also manage specialized diets if a resident needs one. Further to that is the socialization throughout the day. So activities that are really geared toward each different resident's abilities so that they have success throughout their day and it's very rewarding for them. Avenir really prides itself to be a pillar in the communities, so we want our families to know that they're welcome to come to any Avenir community. We will help them to our best of our ability, utilizing our resources and our connections to help educate them. The best way for somebody to learn more about our company would be to visit our website or to phone any one of the 3 communities here in Arizona. It's really important for people to know that they're not alone in this journey and that Avenir Senior Living is here to help.
Thanks for joining us on Your Health. We hope you have a happy and healthy summer. I'm Erica Cardenas. See you next time.